Many of my patients have expressed concerns about the safety of the COVID vaccine. The COVID vaccine is 90 to 95% effective. It does not alter your DNA or cause infertility. It is completely safe. It is very important for everyone to get the COVID vaccine to protect themselves from the virus, especially in vulnerable populations, including the African American and Latinx community. Unfortunately, certain groups have increased incidence of adverse outcomes, including 2 to 3 times in the African American and Latinx population when it comes to death and hospitalization. A diverse group of scientists and patients created the vaccine, making it safe for all backgrounds.
Until recently, it was recommended that coronavirus vaccines be given 2 weeks apart from other vaccines. That was mostly just because coronavirus vaccines are newer. That's recently changed. Now recommendations say you can get all your vaccines all together. That being said, it still might be a good idea to get coronavirus vaccines separately. Remember, side effects after the vaccines, injection site soreness, muscle aches, and fatigue are common after coronavirus vaccination. So if you feel bad after the vaccine, you know that it's from the coronavirus vaccine, not another vaccine.
A question we get a lot is it really necessary for our pediatric patients to get vaccinated against COVID-19 when they don't seem to be as affected as their adult counterparts, not getting quite as sick with their acute infection? I have a couple answers for this, but overall, yes, they should get vaccinated. What we're seeing with our preteens and our adolescent patients is this pandemic has been very hard on them. The isolation of not being able to participate in their normal sports and activities has caused a lot of mental health issues, including anxiety and depression. Finally, our children do not live in isolation. And so even a very mild case of COVID-19, which would be the best case scenario, is going to cost multiple days off of work for a parent or a caregiver. And also during the time prior to their diagnosis with COVID, the patient is often already infectious and could have been around people who are not eligible for the vaccine, whether that be due to age or medical conditions like cancer or immunodeficiencies. It really is our job to be able to take care of everyone in the community. And so it's important that we do our part by getting vaccinated against COVID-19 when we are eligible.
I've been asked to talk about whether the COVID vaccine is safe and effective in children. Specifically, the answer is yes to that. The vaccine has been looked at in people 16 and older and adults. It has been found to be 95% effective. Testing done in children, and over 2,000 children done by Pfizer, was found that between the ages of 12 and 15, the vaccine is actually 100% effective against the COVID disease.
To schedule a vaccine appointment or to learn about our vaccine clinic, please visit the link below.